thrilled that you're able to be with us this morning in this morning's Business Insight. At the beginning of the show, we talked about the trend in employee benefits packages toward incentivized health management programs. A lot of businesses are finding rewarding employees for healthy lifestyle choices is not only good for the employees, it's definitely good for business. Joining us now, Dave Beckett, who's been monitoring this trend at the consulting firm Mercer. Dave, thanks for coming in.
Morning.
Tell us about Mercer. What do you specialize in?
Well, Brian, Mercer is a global professional services firm. We help clients worldwide with the health, talent, retirement, and investment needs of their organizations.
So as you watch this trend, how far are companies willing to go to nudge their employees toward a healthier lifestyle? What kind of incentives are they using?
That's a great question. What fascinates us in working with our clients is that we have seen a vast spectrum of organizations' approaches and strategies with regard to the so-called carrot and stick question. And it really ranges from organizations that are just dipping their toe into the wellness spectrum and starting to offer some incentives, gift cards, et cetera, for certain activities. But then we've seen other organizations who have been at the wellness game, if you will, for several years and have gone through a transformation from the incremental incentive type program all the way to more punitive, or perhaps punitive is not quite the right term, but getting to the point where they've gone from incentives to compliance-based programs. And some employers have seen great results in productivity, reduced healthcare costs, reduced prescription drug claims, et cetera, by really getting their workforce healthy and being more productive.
So as parents, when we're training children to do things a certain way, incentives work for some, penalties work for others. So you're saying some companies are actually penalizing employees who are not making healthy choices?
Yes, we have seen some of our clients and other organizations that we've talked to that have firmly believed that in order to get adults to do things that they, quite frankly, really probably don't want to do, sometimes it does take more of a stick approach. And really, to try to move the needle, we typically advise our clients that it takes a multi-year, multi-pronged effort and strategy so that you go again from that kind of incentive phase to the more compliance-based aspect. And yes, there are certain organizations here in Cincinnati that have put in surcharges for smoking. They've put in surcharges for other activities that their employees and or their dependents have not adhered to, things that we call disease management or care management programs, where a case manager or a nurse manager is assigned to someone with chronic conditions, and perhaps that employee or the dependent is not following the protocol that's outlined, and there could potentially be some negative ramifications in the form of having to pay a higher level of payroll deductions.
Dave, it might seem obvious to most, but why is good health good business?
Well, I think that as we really start to understand that in today's environment, every organization is struggling for talent, and that's definitely the primary concern of most HR and other business leaders I talk to. But I think the secondary aspect of that is simply the fact that we now have enough information and enough evidence to demonstrate and prove that those organizations that have a healthier workforce are more productive and definitely drive better results to the bottom line.
Very interesting. Dave Beckett with Mercer. Thank you for your insight this morning. We appreciate it.
Thank you, Brian.